Hoy vamos a continuar con la segunda parte de lo que va a ser Clinical History and Examination. Acuérdense que esta plática está enfocada más que nada en el área de neurología. Entonces, en cuestión de examination, no vamos a cubrir como tal, cómo sería como una examinación física general, sino como los signos que encontraríamos más típicos en condiciones neurológicas y obviamente en inglés, porque siendo ya está en curso de inglés pues vamos a atender toda nuestra plática en inglés. Saben que cualquier pregunta la pueden realizar en el chat o alzar su manita y voy a estar pendiente a ello. Y bueno, iniciamos sin más preámbulo. Hablando acerca como de General Physical Examination, vamos a tener principios, vamos a tener General Principles of Physical Examination. Si me pueden escuchar bien, es que creo que la otra vez tenía problemas con mi audio. Si no, para conectarme en otro
Sí, te
dispositivo.
escuchas bien, Jimena.
Ok, perfecto. Bueno, de considerando los general principles of physical examination, es de que patients are always examined from the right side of the bed. Es como algo muy general. You must write briefly, algo breve. You must follow a system. Vamos a seguir un sistema, vamos a seguir un orden que vamos a ver ahorita. You must examine the whole body. Vamos a tener que revisar todo el cuerpo en una physical examination. O sea, a pesar de que nosotros sabemos de que tal vez nos estamos enfocando en el área neurológica, bueno, nosotros hacemos una historia clínica, una exploración física, es una exploración física completa para aquellos que todavía no están tan relacionados como con un expediente clínico, un formato de historia clínica, etcétera. La exploración física es sí se tiene que hacer siempre una exploración física completa. Y eso es prácticamente lo que vamos a ver hoy. Entonces, order. Vamos a tener que seguir un order. Y first, we start with general appearance. General appearance es como la apariencia general del paciente. O sea, vamos a ver, if a patient walks into a room and is he walking? Is he expressing pain? Like, does he have like a pain expression on the face? También puede ser, por ejemplo, em, o sea, como a una apariencia general, la primera apariencia que ves en el paciente. Second, vital signs. Vital signs es lo siguiente que vamos a examinar y después ya vamos a examinar, ahora sí vamos por sistemas. Examine the head, eyes, ears, nose, mouth. Primero vamos de arriba hacia abajo y después de que terminamos con throat, neck, ahora sí vamos con hands. Now, examine the chest. We divide the examination of the chest into three parts: heart, lungs, and breast. Then abdomen, then extremities, y al final ya vamos como tal con la neurological examination. Hoy vamos a cubrir las primeras partes porque con sí la neurological examination vamos a tener ahora sí una lección propiamente que va a ser de neurological examination. Y al igual que un taller, como ya les había dicho. Vital signs. Bueno, vital signs en inglés sería, por ejemplo, heart rate. Heart rate, y esta heart rate se va a medir en beats per minute. Beats per minute, normal heart rate para ver beats per minute, it goes from 60 to 100. Less than 60 beats per minute, it's bradycardia. More than 100 beats per minute is tachycardia. Now, blood pressure. Blood pressure, normal pressure is like 120 and 80. Less than 90 or 60 is hypertension. More than 130 or 90 is hypertensive. And now respiratory rate. Respiratory rate 10 from 10 to 20 breaths per minute. That's how it's calculated, breaths per minute. Less than 10 is hyperventilation. More than 20 is hyperventilation. Oxygen saturation. This is the next one, like 90. It's from 95 to 100%. Less than 95%, it represents hypoxemia. Now, temperature. Temperature here is in Fahrenheit. Sabemos que Fahrenheit es como el sistema, o sea, comúnmente utilizado sobre todo en Estados Unidos. Es como el sistema americano, ese sería como los Fahrenheit. Ellos como en Fahrenheit tenían, sería como 97.8 from 100.4 Fahrenheit y menores es hypothermia, mayores es febrile temperature, pero pues nosotros lo manejaríamos en grados centígrados. Ahora sí. Now, beginning with skin. Skin related to neurological disorders. We could present sometimes jaundice. Why jaundice is important? Because liver disease is kind of a cause of confusional state or movement disorder. And jaundice is like this yellowish appearance in the face, also like in eyes. That's jaundice. Coarse, dry skin, dry, brittle hair, and subcutaneous edema are proper for hypothyroidism. For example, this is like dry skin, and this would be like the coarse, dry skin. O sea, tendríamos como dry, que sería seco, coarse sería grueso, es como esta piel gruesa, áspera y que es seca, y eso nos daría como indicios de hypothyroidism of and also like subcutaneous edema. Now, petechia. Petechia is like characteristic for example, in meningococcal meningitis. Meningitis is like this is petechia. It's important to differentiate like petechia and ecchymosis. This is ecchymosis. Ecchymosis, like this is like the appearance, like a kind of purple appearance, a characteristic like from hematomas. And petechia is like this kind of little dots. You have these little reddish dots in on the skin, and that's petechia. Petechia or ecchymosis are proper also from coagulopathies as a cause of subdural, intracerebral, or paraspinal hemorrhage. So it's important that if we're evaluating our patient and if we find these signs, it's kind of like the to make like a proper differential diagnosis, because sometimes petechiae ecchymosis or and coarse dry skin or jaundice are like kind of proper from another diseases, not proper from neurological diseases. But if we have a patient like with meningitis that
Ah,
has
pero entonces, ¿cómo le facilitaron todo a esta muchacha?
to be like that, podrían apagar su micrófono, por favor. Gracias, Michelle. Gracias, muchas gracias. Now, following the skin examination, splinter. The splinter would be like this subungual hemorrhages that we can find in bacterial endocarditis. Remember that endocarditis could be like a cause of stroke. So it's important that if we have like a patient with a stroke, maybe we're looking for probably the cause of stroke. And if we have like a splinter or ulcer nose or lingual lesions, we could like probably suspect that the patient had like already have a bacterial endocarditis, and that could probably cause would be like the cause of a stroke, right? Now, Osler notes this is like painful swells on the distal fingers, and Osler notes are different from Janeway lesions and Janeway lesions are also presented on the hands, but this is like painless hemorrhages on the palms and soles. Now, hot dry skin. These are proper characteristics from anticholinergic drug intoxication. Now, head, eyes, ears, and neck. First, we examine like the head. Head, it's important in neurology. First and foremost, because we have signs of we could have like signs of trauma. For example, scalp lacerations or contusions. And also like here in head, like it's really common that, for example, if we have a patient with basal skull fracture, in basal skull fracture we have like three characteristic signs. And the first one, it would be like the battle sign. The battle sign that is this post-auricular hematoma. This is like really characteristic from basal skull fracture, battle sign. Also, we have like the raccoon eyes. Raccoon eyes are also really characteristic of basal skull fractures, and this would be like this periorbital hematoma and hemotympanum. Hemotympanum or cerebrospinal fluid, otorrhea or rhinorrhea. Also, like we could make like a percussion of the skull over a subdural hematoma, and this could may cause pain. Not precisely, but it may cause pain. Eyes. And if we go to like, if we focus on the eyes in patients with neurological, like a neurological disorder or something like that, we could see, like, for example, and icterius sclerae are seen in liver disease. And we already learned that liver disease could cause like a confusional state or a movement disorder that could be like a differential diagnosis in a neurological patient, right? Now, pigmented gastroplasia, and this is like a ring, like a corneal ring, and is best seen by slit lamp examination. And this particular ring, it's seen in Wilson's disease. And Wilson's disease would be this disease that is produced by copper deposits. So these copper deposits are presented in the cornea, and these could like express this ring in the cornea. Also, like we would have like the rod spots. The rod spots are these retinal hemorrhages that occur also in bacterial endocarditis. And remember, we already said that bacterial endocarditis may cause a stroke. In exophthalmos is observed with hyperthyroidism, orbital or retroorbital masses, and also cavernous sinus thrombosis. Then exophthalmos could be like just like a sign presented in many diseases, but it is important to consider that if we have a patient with a neurological disorder and has exophthalmos, this could be like kind of like a differential diagnosis. Now, speaking about like ears, like we have like the otoscopic examination. And otoscopic examination, it's properly to evaluate like the tympanic membrane. The tympanic membrane could be normal. On the left side, we have like this normal tympanic membrane. And if you could see like the tympanic membrane, it has like, if you already saw this in your lessons, is like we have the pars tensa, conlight, umbo, the pars flaccida, and lateral process of malleus. And this is like a normal tympanic membrane, which looks like really clear, and it doesn't have like any inflammation or whatsoever. But it has like a bulging membrane, which is like this elevation of the tympanic membrane. We have like elevation here, so it's bulging membrane. We have opacity, like a pacification of membrane, and we also have prominent dilated vessels, which is like a sign of erythema. This could be like a sign of otitis media, which may spread to produce bacterial meningitis. You remember that meningitis, one of the causes is otitis media. So if we have a patient that could have meningitis, we can see like maybe the main cause of this meningitis could be like this otitis media. Also, neck is really important in neurological evaluation. Why? Because in neck we have this part of meningeal signs such as Brudzinski sign or Kernig sign. And remember the difference between these signs. Brudzinski sign. Brzezinski's sign is would be like this neck stiffness. Stiffness is the same of rigidity. This neck stiffness or neck rigidity would be if we make like a passive flexion of neck, and this is going to cause like a flexion of both legs and thighs. But if we talk about Kerning sign, the patient is supine, also like in Brzezinski sign, but the hip is flat at 90 degrees. And these 90 degrees, we're going to try to extend the knee, extend the knee more, and the patient is going to be unable to do this movement. So these signs, Brudzinski and Koenig, are meningeal signs. And Koenig signs would be the sign that is resistance to passive extension of the knee with the hip flats. Now, restricted lateral movement or flexion or rotation of the neck may accompany cervical spondylosis. Also, auscultation of the neck may reveal a carotid brood, which can be a risk factor for stroke. Now, chest and cardiovascular, and related like to neurology, neuromuscular disorders, for example, if we talk about sclerosis, especially like amyotrophic lateral sclerosis. Remember, this is like neuromuscular disorder. And these disorders can cause to reach a stage where the patient can no longer breathe. Why? Because these neurons that function in our breathing system can make cause like respiratory muscle weakness, and this respiratory muscle weakness and may cause the patient to be unable to do the normal breathing and ventilation movements. And these patients may require intubation or like an advanced management of the airway, such as intercostal muscle retraction muscles. Heart murmurs may be associated with valvular heart disease and infective endocarditis, which predispose to stroke. Related to abdomen, it's not really something specific in neurological disorders, but we can make some differential diagnosis related to back pain, because some diseases like abdomen diseases could spread to like the pain could spread or irradiate to the back. We know that. But some back pains are purely neurological. So it's important to explore the abdomen, like to get rid of these suspicions, like maybe we could have from abdomen diseases that could be related to back pain. So liver disease is always important in patients with a new onset of back pain, because intra-abdominal processes such as pancreatic carcinoma or aortic aneurysm may present with pain that radiates to the back. So extremities and back. Extremities and back are really important, specifically if we talk about vertebrate lesions or spinal lesions. So here we're going to have some signs that could be characteristic in mat lesions from the spine. But if we are going to talk about like these lesions that could provoke like some back pain or probably some dysfunction in our extremities, sorry, could be like Lastic sign. Lastic sign. In Lastic sign is like this first sign. The patient is supine, and then we stretch the leg, and this leg is like doing this extension of the leg. It stretches like the nerve roots from L4 to S2. So these roots, and also like the sciatic nerve. And for example, we also have this other sign that is raising extended leg, but the patient is prone and the reverse straight leg raising. And this is going to stretch the nerve roots from L2 to L4 and also the femoral nerve. And these signs could may like give us an idea from where the mass lesion, like or the lesion or the nerve lesion properly it's coming from the spine. Localized pain with percussion of the spine may be a sign of vertebral or epidural infection. And also auscultation of the spine may reveal a bruise due to spinal vascular malformation. Now, rectal and pelvic. Rectal examination can provide evidence of gastrointestinal bleeding, which is a common precipitant of hepatic encephalopathy. And also, rectal or pelvic examination may disclose a mass lesion responsible for pain referred to the back. For example, if we have like a tumor that is rectal and it's like kind of pressing our roots, like our nerve roots from our spine, of course, is going to cause like some neurological dysfunction or some neurological disorder related more to movement from lower limbs. Now, if we are going to be specific about common symptoms in the central nervous system, first we're going to talk about handedness. Handedness would be like adhesión, o sea, como si el paciente es diestro, zurdo, handedness. O sea, ¿cuál dominancia vas a tener de la mano? Entonces, handedness. Entonces, si te pregunta, tú le preguntas al paciente en tu examinación, handedness is going to be like right-handed or left-handed. O sea, right-handed es diestro, left-handed es zurdo. ¿Ok? Entonces seguimos. Loss of consciousness. Loss of consciousness. Sudden. Ya habíamos visto eso. O sea, es repentino o warning. O sea, va progresando y lo fue alertando esta pérdida de la conciencia. Sudden o warning. Ahora vamos a tener tongue biting. Eso es como morder la lengua. Injury sustained. Passage of urine, incontinence. O sea, si el paciente en su pérdida de la conciencia todavía orina o tiene incontinencia urinaria. Duration, after effects, precipitating cause, in relief with food. Ahora, mental state. ¿Por qué es importante? Perdón, aquí, this is important, relief with food. Sugar, because for example, patients with loss of consciousness, some of the cause could be hypoglycemia. And like this, for example, if the glucose is really low on on blood, of course, it could be like a cause from loss of consciousness. Mental state. Mental state, it's something, of course, like it's really basic in neurological examination. But in mental state, and related, if we talk about alterations in the mental state, it could be like alteration in memory. We could have like memory disorder, and memory is divided in short and long-term memory. Independent opinion of relative or friends should be sought. Also, hallucinations, agitations, delusion, and intellectual changes. These are some things we need to seek in our patients regarding the mental state. Luego vamos a tener como una propia evaluación del mental state. Ya cuando veamos como la exploración neurológica, ahí vamos a ver cómo se evalúa como mental state. Ahora, headache. Headache. It's important that in headache, we look like the character of the headache, the site or localization of the headache, the duration, associated symptoms. For example, if the headache is associated with vomiting, it could be like probably the cause could be like some subarachnoid hemorrhage. Also like aggravating or relieving symptoms, factores que lo agravan o lo alinean. Time of day, change in postures, training, defecation, maturation, Todas estas características son importantes para hablar en headache. Headache sería cefalea. Confusion, confusion. En confusion vamos a evaluar lo que va a ser como memory impairment, getting lost, difficulty understanding or producing spoken or written language, problems with numbers, faulty judgment, impersonality change, or combinations thereof. Dizziness. Dizziness es importante porque dizziness sería como mareo, como tal. Pero acuérdense que para los pacientes tanto vértigo, imbalance, presinco y mareos puede ser lo mismo. Entonces aquí sí hay que hacer demasiadas preguntas, bueno, no tantas preguntas, pero sí preguntarle muy bien al paciente cómo es la característica de este mareo. ¿Por qué? Porque podemos tener todas estas que son diferentes, que pudieran ser lo mismo para el paciente, pero pudieran indicar diferentes cuadros clínicos. Por ejemplo, dizziness, que vendría siendo este mareo, podría ser vertigo. Vertigo, que sería como the illusion of movement of oneself or the environment. O también podría ser imbalance. Imbalance sería como esta unsteadiness due to extrapyramidal, vestibular, cerebellar, or sensory deficits. Also, presyncope. Presyncope, que sería como lightheadedness resulting from cerebral hypoperfusion. O sea, y todos estos tienen una etiología diferente. Entonces, sí tenemos que hacerle una pregunta al paciente, igual evaluarlo, ver cómo es este desequilibrio, cómo es este mareo, cómo se presenta y evaluar bien la clínica. Weakness. Weakness va a ser diferente, o sea, weakness es debilidad. Pero en neurology is different that from the patients. The patients lo dicen como, porque para el paciente puede ser como generalized fatigue, lethargy, or even sensory disturbances. But in neurology is loss of power resulting from disorders affecting motor pathways in the central peripheral nervous system or skeletal muscle. Ahora, shaking. Shaking, como tal, sería temblar. Pero shaking, temblar, puede, o sea, hay muchos abnormal movement disorders que pudieran dar shaking. Y es importante también como diferenciar de estos abnormal movements, por ejemplo, tremor, chorea, ptosis, myoclonus, fasciculations, porque aquí yo les agrego una tabla, prácticamente como describiendo todas estas diferencias de abnormal movements en neurología, porque shaking podría ser todos estos. Entonces, también tenemos que especificar cuál es como tremor. Okay, tremor is the rhythmic oscillation of a body part around one or more joints. ¿Cuáles son las typical features? Features es características, características típicas, características típicas. A regular oscillatory. Okay, associated features va a ser cough willing, es like postural tremor, posicional, o sea, este es como un temblor posicional. Okay, so postural tremor, temblor posicional. Chorea. Chorea is like a brief, purposeless, and quick movements that often progress from proximal to distal segments fluency. Typical features random, arithmetic, they are rapid, occasionally suppressible, y associated features hypotonia, motor persistence. Pero bueno, no voy a ahondar mucho en estos. Dejo aquí la tabla solamente para que vean de que efectivamente, o sea, podemos tener todos estos movement disorders. Podríamos decir que shaking podrían ser todos, pero hay que especificar si es tremor, si es chorea, si es valism, si son tics, si es apoptosis, si es myoclonus, si es dystonia, si son también como estereotipias, stereotypes, porque ciertas estereotipas también podrían ser como cierto diagnóstico diferencial de crisis epilépticas. Now, numbness. Numbness. Numbness sería como esta pérdida de la sensibilidad. Entonces, hablando de sensory disturbances o estos trastornos de la sensibilidad, vamos a tener hyperesthesia, que es decreased sensitivity, hyperesthesia, sería the increased sensitivity, y paresthesia is like pins and needles sensation, o sea, hormigueo, picazón, o sea, me está picando, eso es paresthesia. Ahora, blurred vision. Blurred vision es mi visión borrosa. Entonces, en visión borrosa también tenemos que ver si es diplopia, double vision, ocular oscillation, si el paciente tiene reduced visual acuity, and visual field cuts, spells. Spells como tal serían ataques. Ataques. O sea, y spells no puede ser, por ejemplo, simplemente como un ataque de epilepsia. Si estamos hablando de un ataque en general, spells. Entonces, spells van a ser como episodic and often recurrent symptoms such as in epilepsy or syncope, like in fainting. It's like spells. No podríamos decir que es lo mismo que seizures, pero podríamos decir que si el paciente tiene estos spells, estos ataques que se caracterizan por seizures, entonces esos spells, esos ataques in epilepsy serían como seizures in epilepsy. Y ya, creo que hasta aquí terminamos lo que es General Physical Examination. Este, Para la próxima clase ya vamos a ver propiamente Neurological Examination. Si alguien tiene alguna pregunta, adelante. Algún comentario, sugerencia, también. Y doy el espacio de 1 minuto por si alguien tiene una pregunta. Bueno, si no, chicos, sería todo por el día de hoy. No sé si ya mandaron el link de asistencia. Creo que no tenemos link de asistencia. Podemos dejar la grabación. Ya, ¿eh? Muchas gracias.